everybody. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here this afternoon with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale. Also with us this morning is Dr. Alvin Wong, this afternoon, Dr. Alvin Wong, Regional EMS Director, and Dr. Brenda Weiss, Administrator of our Office of Public Health. This remains a rapidly evolving situation here in Montgomery County. As I've said before, we don't have complete information on every single situation that I'm going to describe to you today. I will do my best to answer all of your questions when my prepared remarks are finished, but I may not be able to answer your questions fully. So, as we are starting as our process, I'm going to update you from our press conference yesterday afternoon, and I will tell you now that we will plan to have another press conference tomorrow afternoon at about this time. Since yesterday afternoon, we have had 3 new presumptive positive cases of COVID-19 in Montgomery County. The first case is an adult female, age 18, who resides in the same household as a previously identified presumptive positive individual in Lower Gwinnett. Her symptoms are mild and do not require hospitalization. She is in isolation at home and is being monitored. She attends Germantown Academy, and contact tracing for this individual is complete. The second is an adult female, age 62, who resides in the same household as a previously identified presumptive positive individual in Upper Marion. She is currently hospitalized in isolation at the Hospital of the University of Pennsylvania. Contact tracing for this individual is complete. The third case is an adult female, age 70, who resides in Cheltenham Township. She is currently hospitalized in Philadelphia. The contact tracing for this individual is not fully complete. However, as of this time, and I want to emphasize that this information could change, we are unable to determine how this individual became infected with COVID-19. But I want to emphasize we have not completed the contact tracing. Should we be unable to determine how she was infected, this individual would represent Montgomery County's first instance of community spread. I want to give you a brief update on the CHOP King of Prussia outpatient facility. We are actively monitoring, and when I say we, I mean the Montgomery County Office of Public Health is actively monitoring all Montgomery County residents whose names have been given to us by CHOP as direct contacts of the CHOP physician. I want to clarify some timing issues, which I think have been a little challenging for all of us. The State Department of Health is releasing test results of COVID-19 testing at noon, 4 p.m., and at 8:30 p.m. We have decided to continue to just have a once-a-day briefing at about this time because we can't begin any data gathering until we know who the people are with the presumptive positive. So for us to speak to you at 4:05, I'm not going to really be able to give you much information. I'd like to share with you what we're doing here at the county for our workforce and for our county visitors who come to our offices. We hope that other businesses will follow suit. The goal of all of these steps is to minimize the spread of COVID-19 in our community. County operations are continuing as planned. For now, there is no planned closures or reduction in services. We've provided all of our county staff with information on COVID-19, including fact sheets, informational videos, presentations, and links to trusted sources of data. We've created an employee intranet site where all updates, information, and new procedures are located for ease of use. We've activated enhanced cleaning protocols, which include more frequent and thorough cleanings of common areas accessible to the public and high traffic areas within offices. We are installing more hand sanitizer stations and providing more hand sanitizer solution in public areas. We've established exposure control policy. This policy addresses minimizing the risk of having sick employees in the workplace and providing paid leave for employees who are exposed to the virus in high-risk areas that cannot return to the workplace or work from home. We are canceling or hosting virtually board meetings, large meetings, events, and trainings. We are canceling attendance at conferences and workings and workshops, or requiring virtual attendance to minimize exposure. Mandatory trainings for staff in order for them to do their jobs will continue. Sometimes there's, for instance, a state requirement that a certain training happen within a certain time frame, otherwise that individual can't do their job, so we are allowing those to continue. We've provided guidance on having employees work from home. We're staggering schedules, or using 4-day week schedules to reduce the number of employees in the workforce in the building at any one time. The goal being that if one person gets sick, hopefully someone is at home who is not sick and can keep those duties going. We are allowing our offices to use scheduling of appointments that previously allowed for walk-ins. This will minimize the exposure to public and employees. And as a self-insured entity, we're working with our insurance carrier to pay for extra 30-day medication supply for employees to have on hand should they need to self-isolate. It is time to seriously consider canceling or postponing large gatherings of people in Montgomery County. Those of you who've been at these briefings have heard me talk about the difference between containment and mitigation. Whenever there's a communicable disease in our community, the first goal is to contain it. But when it becomes clear that that may not be at 100%, then we move to mitigation, which is an effort to keep the spread as minimal as possible. And that is our goal here. We want to reduce or minimize the spread of COVID-19 in Montgomery County. We do not want to experience the type of spread that you've seen in Italy or Washington State or other parts of the world. Certainly, if you are elderly, have an underlying serious medical condition, or immunocompromised, you should absolutely avoid large gatherings. We must all begin to put the greater good of our community ahead of our personal convenience. Let me just take a moment to give some leveling information for everybody. The symptoms of COVID-19 are fever, cough, and shortness of breath. If you are experiencing these symptoms and they are not life-threatening, please stay home. Please stay home and get on the phone and call your health provider or your local hospital or clinic. We do not want you walking unannounced into any of these facilities. If you're experiencing life-threatening symptoms, do not hesitate to call 911. Our EMS professionals are ready and prepared to come get you and take you wherever you need to go. I want to again urge our employers who do not offer paid sick time to please consider at the very least a temporary policy so that your employees who depend on that paycheck every week can make the choice to do what is right for our entire community and stay at home while keeping their family economically secure. We've received a number of questions about the difference between COVID-19 and the flu. First, they are two different viruses. What does that mean? The virus that causes the flu bears no relation to the virus that causes COVID-19. They're totally separate viruses. Because of that, the flu vaccine does not offer any protection for COVID-19, and medications that are routinely prescribed for the flu do not seem to have any impact on COVID-19. So as of right now, there is no treatment other than what's called supportive. So, you can take a medication to reduce your fever or something for your cough, but there's no specific medication to treat COVID-19. There is also no vaccine for COVID-19. I want to make that abundantly clear. We are at least 1 year away, at least, from a vaccine for COVID-19. I also want to remind people that 80% of individuals who get this have very mild disease. So 80%, the vast majority, will have very mild disease. The individuals that appear to be most at risk from what we know now are the elderly or anyone with a serious underlying medical condition or that are immunocompromised. That seems to be, from what we can gather, and again, this is brand new for all of us, those that are the most at risk. There have been many questions about when a person is contagious. And again, I remind you, this is a new disease, so no one can say these things with absolute certainty. We just don't have the science behind it. However, as of today, this is what the Center for Disease Control is saying about when an individual is contagious. People are thought to be most contagious when they are most symptomatic or the most sick. Some spread might be possible before people show symptoms. There have been reports of this occurring with coronavirus, but this is not thought to be the main way that the virus spreads. The main way that it spreads is when people are sick. There's also been a lot of questions about contacts of contacts, asymptomatic contacts of contacts. As of right now, the CDC does not consider asymptomatic contacts of asymptomatic contacts. I'm going to say that one more time. The CDC does not consider someone without symptoms who's a contact, and then the next contact is also asymptomatic, contacts of contacts. These people are not considered exposed. That is the Center for Disease Control's definition as of today. We want to reassure everyone that we have been planning for this eventuality. I want to thank our county staff, our municipal partners, including all of our first responders, our school superintendents, and heads of school for their cooperation and their calm and evidence-driven responses to COVID-19. And with that, I will take questions.
Commissioner, there's great concern about the CHOP facility, especially in school communities. People whose students, their children, are not in school today, or maybe in some communities for the rest of the week. What's the response from the county concerning CHOP?
We are monitoring all the individuals who are county residents whose names we were given, and we will, as we have done, if anyone is a presumptive positive, if anyone has symptoms and is tested and is a presumptive positive, we will let you know.
How about if they were from other counties visiting that CHOP facility for a consultation?
So individuals that live in other counties are being monitored by their county health department if they have one. If they do not have a county health department, that's up to the Pennsylvania Department of Health to conduct that monitoring.
What is the total number of people whose names you know of had received any kind of services there, who might be under any kind of monitoring?
I don't have that information.
Are we talking a dozen, 100?
I believe that CHOP did release a press release this afternoon that had some numbers in it.
Also, that facility is in the nexus of an incredibly densely populated and newly redeveloped section of your county. A lot of people, there's a lot of commerce around there. What, if anything, are you doing to see if the people who worked in that facility with that doctor may have also exposed people at the Wegmans, at the restaurants, at Town Center?
Let me describe
The mall.
contact tracing to you. So when we have an individual who we know is presumed positive for COVID-19, we initiate what's called contact tracing. And we have a very detailed conversation with that individual. We ask them the names of any person that they can think of that they've had contact with during the appropriate time period. We also ask them to try to recall any place that they've been in that same time period. A grocery store, a drugstore, the gym, a faith place of worship, anything like that. And then we reach out to those places. If it is a business or public place, we notify that business. We ask them to close and do a deep clean in their establishment and not reopen until that cleaning is done. And a member of our Department of Health does visit the location to ensure that that has taken place. With the individuals, we reach out to those individuals, we let them know that they have had a direct contact with a presumed positive COVID-19 individual, and they are asked to isolate. We call them every day and ask about symptoms, and we also ask them to monitor their temperature at least twice a day.
So have you reached out to any of the neighboring businesses in that commercial district with that message?
We would have done that if any of the direct contacts of the physician, actually let me back that up one step. At this point, we are monitoring the direct contacts of the physician. If the physician went to any of those places, we would have. If none of the direct contacts that I'm aware of at this point are presumptive positive, and so we would not have then taken that next step.
In the Cheltenham case, the 70-year-old woman, did she live alone, or were other people in the home that are self-isolating there?
There are other members of the household that are self-isolating.
And then the Upper Marion case, since we know that the Upper Marion CHOP doctor lived in Upper Marion, we can presume this is his spouse?
This individual resided in the same household as the individual that we spoke about yesterday who lives in Upper Marion.
Is there any indication if, and I don't even know if you could know this, if she got this while traveling or if she contracted it while back home with him? Is that possible to know?
I believe they both traveled to a country outside of the United States where COVID-19 is active.
But you can't say if she contracted it there or if she contracted from him back here. That's.
I don't believe there's any way to know that.
How many additional tests are pending from Montgomery County results from the state?
We don't
department?
discuss persons, it's called persons under investigation, because the vast majority of those tests are negative, and it's extremely confusing to the public to start throwing out lots of different numbers. So if we have any presumptive positives, we will announce that and give you as much detail as we can, while continuing to preserve the anonymity of the individual involved.
Do you feel there's sufficient testing capacity to handle the demand as it's coming out of Montgomery County today?
Here in Montgomery County, we have no unmet needs when it comes to testing.
You mentioned the elderly population being more vulnerable. Is there guidelines to retirement homes and nursing homes at this point?
It's my understanding that long-term care facilities, which are not under our purview here at the county, they are under the purview of the Pennsylvania Department of Health, have received guidance both from PADOH and possibly from the federal government, that part I'm not certain of, about enhanced procedures in their long-term care facilities. I have heard anecdotally that a number are no longer allowing visitors or have really strictly limited visitors. But again, that's not under our direct purview in our County Office of Public Health, so I don't have all those details.
When people hear schools are closing for deep cleaning or businesses or don't travel, this is to try and contain, not to instill panic.
100% true. So no one should be panicking. I have been extremely pleased and reassured by the very calm and professional and evidence-driven response that we've seen from all of our community partners. We have been in regular communication with our school superintendents, both of public and heads of school of private schools. We have shared all information that we have with them. They have our Office of Public Health as a resource, and we've done everything we could to answer their questions as best we could. And as we talked about before, the decision to close the school really needs to be made by that community. In the absence of community spread within the school, in which case we would suggest that they close. We are advising them to consider the needs of their students, their teachers, their parents. I always want to remind superintendents that many of the children across our county get their most nutritious meal of the day at school. So these are all factors that need to be taken into consideration, and each school is doing what they feel is best for their community.
What
Maybe
is
a
the
little late
status?
for this. I'm being asked if you can repeat some of the questions if you think of them, because people are watching it. If you think of that, and you get a question, if you could repeat it so other people, because they can't hear us.
Yeah, I see. I will do that, yes.
How many people in the CHOP facility itself have you tested just because they worked with this physician?
The question was how many people have we tested in the CHOP facility because they work with that physician. All I can tell you is that we are doing monitoring of the direct contacts of the physician whose names we were given by CHOP. If those individuals develop symptoms that are consistent with COVID-19, they will be tested. If any of them are presumptive positives, we will tell you.
Are you
Can you just update the total number of cases this brings us to?
As of right now, here in Montgomery County, and I'm gonna do the caveat that at 4 o'clock, the PADOH will release more test results, but as of right now, we're at 8.
Do you as a county health department or county communicate with other states? Is our understanding in at least one of these cases, there is another member of the household that tested positive that lives in another state. So are you communicating with them? Is that up to the state to communicate? How does that go back and forth with that person's condition versus?
So when we do contact tracing, wherever the contact is or wherever they've been, we reach out, whether that is in another county or in another state. So there is notifications. Usually what happens, if it's even across the county line or in another state, that DOH picks up the ball and continues the tracing in those locales. We have a wonderful working relationship with all of our surrounding counties, and any place where we've needed an assist, we've been gotten all the support that we've needed.
How many of those 8 cases are connected to that one doctor?
With certainty, I can say 1, and that's the individual who resides in the same household.
And what is his status?
I have no information. You have to talk to CHOP.
And yet this is not community spread? If there's only one connection to one person that you know is overseas, how do you define the other 6?
So let me define the difference between community spread versus travel-related spread. Travel-related spread refers to the fact that an individual has traveled, whether in the United States or overseas, to an area where COVID-19 is active. They have returned from that travel to Montgomery County, and they develop symptoms and test presumptive positive for COVID-19. Community spreads, and anyone who gets ill related to them is still considered a travel-related spread, because we can connect the dots between someone who resides in the same household, right, or someone who is a direct contact. That would still be considered travel-related spread. Community spread is different. Community spread means that we are unable to connect the dots to a travel. So that means that this person acquired it in a way that would imply that the virus is out in the community and is spreading on its own, so to speak. So as I said, we do have this one patient who we have, as of yet, we're not totally done with her contact tracing, but as of yet, have not been able to identify connection to travel, either in the United States or overseas, to an area where COVID-19 is present. So we, at this point, are treating this situation as our possible first case of community spread.
Can you speak to the conditions of any of the hospitalized patients?
I cannot speak to the conditions of any of the hospitalized patients.
And I believe we've already asked this, but just making sure, is there any more you can clarify with regard to the relationship of the woman to the doctor in the same household? Is it incorrect to say that this is his wife?
I don't have any personal, definite knowledge about that. That is my assumption, but I don't have direct knowledge of that.
What message are you getting from the hospitals in the county? Are they prepared? What are they doing to potentially take in, if this worsens, many people who might need care and to protect their frontline workers?
So I want to reassure the public that our hospitals and your county and our first responders prepare for these situations routinely. We do drills on all sorts of catastrophes, including communicable diseases. So everyone is prepared. Hospitals have stockpiles, we have stockpiles. We are in regular communication with the State Emergency Management Association with any unmet needs, and we've had wonderful cooperation with all levels of our state and local governments. So I just want to reassure people that we are prepared for this. There is extensive training that's been done. Our EMS professionals know what to do and how to respond to a home where there might be someone with these symptoms to protect themselves. One of the things I do want to emphasize for individuals who are sick, and I mentioned this earlier, to please stay at home and make a phone call first. Part of helping to ensure that our hospital personnel are safe is that they know if someone's coming who has suspected symptoms, so that they can prepare an isolation room, they can make sure that the patient gets a mask outside of the hospital building before they come in, and again, that just helps protect everybody's health. The thing that we're trying to do here, the thing that we're trying to do by sending our employees home to work and to be working here in shifts is to diminish the spread. That's the goal here, is to mitigate the spread, so that we have just hopefully, you know, a bump and then it'll sort of settle out, that we don't find ourselves in a situation like is being experienced in Italy, for example. That's our goal.
One question, for the girl who's 18 years old, or for anyone else who is being diagnosed presumptive positive, how long do they stay in isolation? Is it 14 days past the sick period time, or after they stop showing symptoms?
That is evolving. Let me share with you the guidance that we were given from the Pennsylvania Department of Health this morning. So an individual who is a presumptive positive must be 72 hours fever-free, and that's fever-free without any medicines that would lower a fever. So fever-free on no medications for 72 hours. Then they must be tested twice, 24 hours apart, and both of those tests must be negative. The test is the typical swab. It's a swab of the back of the throat, or sometimes cheek, depending on the situation, as well as up in the nose. So 2 swabs. So that has to be done twice, at least 24 hours apart, and both of those tests have to be negative before the individual will be cleared. So 72 hours fever-free, and then 2 negative tests at least 24 hours apart. That is PA Department of Health guidance as of this morning.
I just want to get some clarity, because as we talked about at the very beginning, you have numbers now, there may be numbers coming out later. Is it that those individuals that are tested, they go to hospitals, they go to doctors, the tests are taken, and then those tests go straight to the State Department of Health, and then those numbers are supplied to you, and that's why we'll have a difference here in about a half hour maybe?
Possibly, yeah. So the question was, what happens with tests and where does the results go? So that's a particularly relevant question today, because yesterday, the Pennsylvania Department of Health activated LabCorp, which is a private testing lab, to conduct testing for COVID-V here in the state of Pennsylvania. If LabCorp has a positive test, it will still go to the state, as has been the case with every test done at a state lab. And then when the state gets it, they tell us. So that way the state has the full database of every presumptive positive here in Pennsylvania, and then they let each county know.
Because yesterday we had our briefing, and she
Right.
went, and then.
Right,
and
that's
I'm
why I
just
wanted to
trying that it's
clarify,
not- there's a
yep.
discrepancy.
So just to repeat, DOH is releasing test results around noon, around 4, and around 8:30 p.m. So we will have this little bit of discrepancy. So what our practice is going to be here, every afternoon at 3, we will update you on everything that's happened since you were here yesterday, at 3:30. So we have these 3 new presumptive positives since yesterday afternoon, bringing our county total to 8.
What are the 2 phone numbers that Montgomery County residents should have at their disposal if they think they or someone they know is infected?
Well, if they have questions, they can call our Office of Public Health, and I can give you 2 phone numbers for that. During business hours, it's 610-278-5117. This is for Montgomery County residents. After hours, it's 610-635-4300. If the symptoms are not life-threatening, they can also call their healthcare provider. If their symptoms are life-threatening, they should call 911.
Absorbing everything you've talked about over the last half hour, Montgomery County is still with the highest number of these cases in the Commonwealth. As a public official, as a parent, I'm not sure, it's just someone who lives here, how concerned are you?
So I am a parent and a physician and a public official, and so I bring all of that to bear as I approach this situation. And I want to reassure the public, the vast majority of people who get this disease, 80%, have very mild symptoms. In fact, some of those folks won't even know they were sick. So that's the vast majority. For the individuals who are at higher risk, and that includes the elderly, people with serious underlying medical conditions, individuals who are immunocompromised. My advice today is to stay home a little bit. Certainly avoid some large gatherings. See if your neighbor can go to the grocery store for you. Just be a little bit careful. And I want to reiterate for all of us that we need to put the needs of our community as a whole ahead of any personal convenience right now. This is a time to really think about our community. Reach out to your neighbors. If you have elderly neighbors, give them a call and see if you can help them out. If you're a parent that finds that you suddenly need to work from home or your child's school is closed, knock on your neighbor's door. This might be a good time to meet your neighbors and see if they can help, watch your child for an hour or two. This is a time where we need to pull together with our friends, our family, our neighbors, and work together as a community. If we take some very common sense steps, I think that we can get ahead of this, or at least mitigate the amount of disease that we'll have here in our community. And we really hope that with these common sense steps that we'll come out of this in an okay shape. Okay, with that, any other final comments from anybody? Okay, great. Thank you all very much. And
Can I ask one question of Dr. Weir? If you don't, Weiss, pardon me, Dr. Weiss, Philadelphia Inquirer. How big a staff do you have on this with the health department? Commissioner Arkush said repeatedly, we've been preparing for this. You obviously do have a health department. Your neighbor next door in Delaware County does not. How big are your troops? How many boots does your office have on the ground?
So we're in an all-hands-on-deck mode. We started with our communicable staff and clinical, and now we've brought in all the staff in the office. So I have about 80 that can be deployed. And then this morning with our Health and Human Services office, they have volunteered, probably 15 of those have now volunteered to join the group as well. So there's many trainings for them to make the calls and help with the trace backs and accept the calls from the public and get those questions answered.
Are you helping any of your neighboring counties with any of this canvassing work?
We have cases that cross county lines, and of course we're going to coordinate. We have routine calls with our county muni health departments, there's 7 of us, and Philadelphia probably 6 times a week. So we're in close lockstep, especially with Philly, sharing information, sharing what's working well, and if we have cases that cross county lines, we're making sure the information is shared with one another.
Thank you.
all right, thank you everyone, and we'll see you tomorrow.
Thank you.
This is a good one.